Hello, this is Dr. John Nasser again in the continued series of irritable bowel syndrome. Today we're going to talk about what diet we should use in treatment of irritable bowel syndrome. So the diet that is recommended is called the low FODMAP diet, and what that stands for is it stands for fermented oligosaccharides, disaccharides, monosaccharides, and polyols. And what I'm going to do is I'm going to show you the 4 categories of foods that are included in that diet, and then I'll tell you why that diet works and how long we should do it. So our first category here is the oligosaccharides, which include foods such as onions, garlics, peas, leeks, lentils, pistachios and cashews, barley, chickpeas, wheat, and artichokes. The second category is the dairy category, which contains disaccharides, and that includes yogurt, ice creams, milk, and any type of custards. Our third category is the monosaccharide category, which includes apples, pears, asparagus, mangoes, honey, and any high fructose foods such as high fructose corn syrup. Now, our last category is the one that contains the polyols, and that is foods like mushrooms, foods like cauliflower, and any confectionery or any sweets or chewing gum that has artificial sweeteners such as sorbitol or mannitol. And so those are the polyols. So this is what's called a FODMAP diet, and therefore we should follow a low FODMAP diet if you experience any irritable bowel syndrome or any abdominal bloating, abdominal distension, or abdominal discomfort related to bloating or distension. The low FODMAP diet should be followed for 6 to 8 weeks. After 6 to 8 weeks, you should start reintroducing these foods by categories. And at that point, you would be able to tell which category of these foods is what's causing your symptoms. Now, one little trick is if you want to try to use these foods and don't want to eliminate them, is to use some digestive enzymes before eating them, such as BINO. And that is a digestive enzyme that would digest the food, rather than allowing the bacteria to digest it and produce the disulfides, which are the gases that cause the abdominal bloating and distension and discomfort. So follow the low FODMAP diet. Studies have shown it's very effective, and people benefit in more than 50% of the cases, sometimes in 80% of the cases. And please always feel free to reach out to me on my email, john.nasser@gmail.com, or on my Instagram handle, the gastroclub, _gastroclub_. And I'll see you on the next episode. Thank you.